Okay, so we all know that the internet can be your own worst enemy when Googling medical symptoms. But in a COVID-19 world, how do you know when to relax and when to see a doctor? Joining us now with those answers are the authors of the book, Am I Dying? A Complete Guide to Your Symptoms and What to Do Next. Dr. Christopher Kelly and Dr. Marc Eisenberg, thank you both so much for being with us today. I feel like this book can help me personally, my inner hypochondriac. Like all of us, it has never been more important to figure out the difference of when you should worry and when you should just relax. Talk to us about your book.
Absolutely. So the book is constructed to take the reader through about 40 different symptoms and help them understand when they get that symptom, when it's likely to be something they can ignore versus something they should make an appointment for versus something they should go straight to the emergency room for. You know, not all shortness of breath is created equal. Not all sore throat is benign. And when we originally started on the book, it was driven in large part because, you know, everybody has symptoms from time to time. And we found that our patients were frequently looking up their symptoms online and inevitably being told that it was a sign of something horrible, that, you know, that every, cough was lung cancer. And so what we originally wanted to do with the book was just to help people understand when a symptom is likely to be serious or not, and what we would ask about if we were seeing them in the office to help make that determination. Obviously, things have changed a little bit in the COVID era where, this potentially very serious disease can have a lot of different symptoms and present in a lot of different ways. And so more than ever now, it's important to understand the symptoms that you have and when they're likely to be a sign of a bigger problem versus something that is likely not so serious.
And Marc, this one's for you. It's Jen. Let's get a little more granular here. We all know that a cough is one of the widely talked about symptoms of COVID-19. So what are you suggesting in your book to someone who's concerned that that tickle or that cough might be something more? And you and I know one of my favorite sayings in medicine: when you hear hooves outside the door, think horses, not zebras. So should you think of the rare? How are you navigating that in your advice?
Well, that's a great question. Obviously, we're all panicked about having COVID, but not every cough and not every fever is COVID. For instance, if you have a cough, but you also have, itchy eyes and a runny nose and a postnasal drip, that cough could just be due to allergies, and you might just need a nasal spray or an allergy pill to alleviate your symptoms. Other reasons for a cough that are pretty common are a lot of people have a cough, especially at night when they're lying down. They can feel sort of a sore throat with it and feel a taste, sort of a metallic taste. That could actually be reflux. So you might need an antacid. So again, I guess the take-home message is there's a lot of reason for having a cough. Clearly, if you have a cough with a fever, muscle pain, and it comes on suddenly, that could be COVID, and you should contact your doctor. But you can't always assume that every fever and every cough is COVID.
Okay, so that makes sense for coughs. But now what about fatigue? We've heard that muscle weakness and shortness of breath are symptoms of COVID-19, but how do you know if you've just been too inactive in quarantine? You haven't been getting up and moving around enough. When should you be concerned, Dr. Kelly?
Yeah, so COVID and the flu both can present with just fatigue and feeling a little run down and tired without any other symptoms. And certainly if you had COVID, you'd want to know about it and get tested. I think that a lot of us are feeling pretty worn out and tired lately, having quarantined at home for months and not being able to do our usual activities. So it's common to feel that way. I think the real difference is just how gradual the onset has been. If you went to bed last night feeling completely fine and have had no issues, and then this morning you wake up and you just feel really awful, just something is not quite right, even if you can't quite put your finger on it, that's a lot more likely to be a sign of a medical problem, a physical problem, than if you just over the past few weeks to months have been progressively feeling more tired. It's quite possible that you've become depressed because of all the problems that are happening in the world right now. Maybe you're just not exercising because your gym is closed and you're feeling tired. Again, if it's been a more gradual, steady issue over weeks to months, that's much less concerning than an abrupt change day to day.
Okay, so that's something to keep in mind. Now, when it does come to the coronavirus, especially with the flu season approaching, what symptoms should we absolutely not ignore? When should we go to the doctor, Dr. Eisenberg?
Yeah, so you definitely don't want to ignore a fever, particularly a high fever, muscle weakness, sort of diffuse body and joint pain. And if you do have a cough, especially a very dry cough that starts pretty quickly and shortness of breath, you should contact your doctor. Look, obviously, if you have any questions, you should get in touch with your doctor. And it's important to remind people that most of us doctors have multiple ways you can see us. So if you don't feel comfortable coming into an office, you could actually call your doctor's office and see if they can do a video visit, or they could speak to you on the phone. But you should definitely not ignore your non-COVID symptoms and your COVID symptoms.
All right, Dr. Christopher Kelly and Dr. Marc Eisenberg, thank you both so much for joining us today. Have a fantastic weekend. And be sure to pick up a copy of their book, Am I Dying?, in stores now.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.